gastric problem disease they have a relation with when people abuse of the psychoactive substances, and social problem. Okay? Social problem, the economical problem. If people are sick, have no good health, they cannot help our economical development. So social problem, economic problem, and we need to help our young people to have job, employment, good salary, good quality of their life. When they have all these conditions, we can fight better those in our situation. I think it's what I can tell you, like introduction. Okay. After when we will finish, we will meet all authorities who was Minister of Foreign Affairs, Mayor. Now we are here. We will continue with our programs. We will visit some center in your country, King Day Center, Center Street, affected youth, and other centers. And when we will finish our mission, we will do report. We will report. We will present report at the ECOWAS plenary session to adopt, and after we will do motion to send to authorities of states and of government of the ECOWAS to encourage all government, different countries ECOWAS to fight, to have a good program to fight this program. Thank you so much.
Good English.
Right.
What do you learn English from?
Thank you for coming. We heard the message and we share the same sentiment. As it relates to political world, our president, when he took over, the first in his address is declared drug and substance abuse as a public health emergency. So that's how much he thinks about drug and drug and substance abuse. He then created a multi-sectoral committee to work together, because drug, as we said, is not a health issue alone, it's social. So we have gender, we talk about employment, it relates to women's sports. We talk about financing, health financing. We have also the security issues, justice ministry. So it's interrelated. So this committee really been working since the president appointed the committee. So I would ask Dr. Zia just to give you a synopsis. So the political will is there. And that's what you need to move a country once the arrowhead sees the vision that the youth have been destroyed. And not only youth, even there are some older people. It's a global thing. Drug is not global, it's a global. When you look on the internet and look at the developed countries, sometimes tears will come to your eyes. It's on the rampage, and it's indeed, I would just say it's a pandemic. Instead of it being an epidemic, it's a pandemic. Going across Africa, it's stealing our next generation. So here it's a pandemic. So we'll now ask Dr. Zia to probably just make a statement on behalf of the ministry. He's been directly involved, the technical person who's been involved with ensuring that the president's agenda as it relates to drug and substance abuse be achieved.
Thank you very much, Madam Minister, and welcome to the delegation. On behalf of the committee, the technical working group, which I chair, we've been able to develop a plan, a national plan for the country. And this national plan is actually built on two pillars. We have one aspect, which is supply reduction. And that pillar is targeting everything about restricting access or restricting importation. So our colleagues in law enforcement, under the leadership of the Ministry of Justice, and those colleagues include the Liberia Drug Enforcement Agency, the police, immigration, and the likes, they have a primary responsibility to ensure that they will target traffickers and dealers, thereby preventing importation of drugs into Liberia. But not just that, so that they can also block every effort aimed at producing drugs in Liberia. Because there are some of these substances that can be grown here, Some of them, they can get the intermediaries and then they can produce them here through different labs. So they have the primary responsibility to prevent supply. But that's not just enough. When the other side, who are the potential users, cannot, if they're not buying, for example, if they don't want the drug, then the seller wouldn't sell. So the other arm is the demand reduction, and there where the Ministry of Health, Ministry of Youth and Sports, Gender, and the other people are. But primarily for the Ministry of Health, we have designed a comprehensive intervention that has different levels of prevention. So we have primary prevention, wherein we intend to prevent potential users from initiating use in the first place. So through this intervention, we've done a lot of work in schools, in communities, and the goal, in church and religious centers, just about everywhere. The goal is to educate people, sensitize them about the danger of drug use, so as to discourage the use. All right, but also with that, to educate parents so that they can look out for their children and identify early signs for referral. So that is the primary prevention. So we're doing a lot in that. And by the way, the evidence proves that prevention is the best thing to do. It's way cheaper and you can have more impact. So we're doing a lot of prevention. We're also massively involved with the social media, traditional radio, television, and the message is to educate people about the danger so that we all can discourage people. There's secondary prevention, which is a form of treatment, early treatment, is intended to treat those who have mild to moderate substance use disorders. They've just started using, they're having problems now, but they are on the mild spectrum. So if we are able to provide quick treatment for them, we're able to get them out. I always say every substance user is a recruiter of others. So if you treat one person, you're preventing many more from getting in. So we are trying to do early treatment. But then also, it is the truth that there are people who have been in drug use, who have been in that situation for a long time. They have chronic and severe substance use disorders. Those include the people in the ghettos and the street corners. They have to be treated as well. So that's the level of tertiary prevention. So the Ministry of Health has started a national treatment program working with established rehabilitation centers, collaborating, supporting them so that we can treat more people. Yeah. So there's one of the entities we work with directly at the Ministry of Health because we have a memorandum of understanding. We send staff, we provide support for people seeking treatment. That entity is called the Mother of Life Rehabilitation Center. So we're working with them now, and we have an evidence-based intervention ongoing. So it means we are doing prevention, we are doing treatment, and our colleagues, rehabilitation and reintegration. The Ministry of Youth and Sports and Gender have primary role to help in reintegrating people rather who have been treated. So they have that role. So we are collaborating in a team. In terms of treatment access, it is challenging because we do not have enough infrastructure. And these are areas that we seek opportunity for collaboration and support. We do not have a lot of rehabilitation centers. The government is making effort to renovate some places. And in fact, the government is building a neuropsychiatric hospital which will serve as national referral center to help treat co-occurring disorders as well as substance use disorders. But infrastructure is one of those areas that we find challenging. So the ministry is also really working to do a lot of integration, healthcare integration, so that where you have primary healthcare facilities, you can also have access to mental health issues. I mean, you can get treatment for mental health disorders, but also substance use disorders. So that's just a snippet of what we're doing, but the conversation can continue. There are a lot more that we intend to do, and we're seeking every possible collaboration and partnership. Thank you, Mr.
Very good.
Yeah, so just a synopsis of what we're doing, and as you were talking about the diseases, cancer, because some of those substances are carcinogenic.
Yes.
So you also get cancer, so that how dangerous the drugs are. Yeah, so we are actually working collaboratively, and the ministry, as he said, we are building a neuropsychiatric hospital, a 3-bedroom hospital in 350-bedroom hospital in Bensonville, so that we can be able to institutionalize and treat patients. So we are a political will is there. It's part of the President PSIP project that is currently ongoing. We are keeping it as a secret, but now because of the drug awareness, with doctors, we don't like to talk a lot about things. The patients, confidentiality. That's why we have brought into the health sector, so you don't see all flaunting things that we are doing, but actually there's a lot ongoing as it relates to mental health. So I don't know, any of my colleagues would like to check. If not, Dr. Zia said, so Dr. Zia, I told you how he's very passionate. Yeah, he's very passionate. He opens my office over 25 times, and out of which 20 I will put him outside.
You can feel it.
Yeah, he's very he's a psychiatrist. Yeah, so you didn't introduce yourself. He's an instructor or professor. I don't even know how to describe it. So please introduce
I'm a
yourself.
psychiatrist, but I'm also an international certified addiction professional.
So we would like to say thank you for receiving us. Thanks for enlightening our mind on some of these things. I think as a lawmaker here, my district is very much invested. Unfortunately, knowing some of the things that you are doing is important. So on behalf of the team, I want to say thank you. We appreciate the audience, appreciate your ability to lead in this matter. We will continue to pray that success will come for all of us. So on behalf of our chairman, Snow, and our leader here, and the entire team, we say thank you so much, and we look forward to better cooperation and coordination in the future. Thank you so much.
Thank you so much.
Because of the congestion of the place, I'm going to ask the minister.
Just 1 minute for just 1 minute. So like Orlando said.